A lot of people are opining about the Will Smith Chris Rock slap, and this video is not about debating if it was real, if it was staged, or what should happen, or whose fault it was. This is about how corporations jump on events in order to push their agenda, and how the corporate press just plays along. Now, if you're like me, you have seen every breakdown possible, including CNN analyst blames Trump for aftermath of Will Smith Chris Rock Oscars incident. In fact, Rosie O'Donnell tweeted, "We watched him do it, then like the Trump years, we don't hold anyone accountable. Shame on us, shame on Will." And if you're not blaming it on Trump, maybe you think that it was staged because the Oscars need more ratings. Or perhaps you're like this guy, who actually had one of the more interesting takes that I've seen. I'm not going to play the video, but I recommend going to this channel, Hugo Talks, because the video, whether you agree or disagree, is an interesting take. And basically what you see, this screenshot that I'm showing here, he's showing articles about what is alopecia and Jada Pinkett Smith's history with alopecia, and all of the articles talking about alopecia, which is this hair condition that Chris Rock basically was joking about. I mean, he wasn't joking about the hair condition, he was joking about her hair, but then that prompted all these headlines about, well, what's up with her hair? What's this hair condition that she has? And Hugo Talks' opinion about all of this is one that I really haven't heard anywhere else, and that is, number one, that it was a staged event, and number two, exactly for that reason, to get people talking about alopecia, because, ta-da, Pfizer has a new drug coming out that's in trial for, you guessed it, alopecia. And so Hugo Talks is like, this is staged, and at least in part, for this reason. If you scroll down to this press release, which was released just a couple days after the Oscars, and just to remind you, Pfizer was a sponsor of the Oscars, they say, well, what's the drug good for? It's being investigated for a range of immunoinflammatory diseases, including ulcerative colitis, Crohn's disease, atopic dermatitis, something I can't pronounce that ends with esophagitis, and alopecia. Now, say you're not willing to go all the way like that guy was, that this entire thing was staged for that particular reason. Though he does say in his video, which again, go watch it yourself, that ratings and other factors would have played into it. But say you think it was totally real. This is very interesting. An almost identical press release was released Wednesday, March 23rd. And it really doesn't say a whole lot of new stuff. In fact, this sentence is almost exactly the same, like what I just read you, that the drug is an oral once a day, blah, 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 that's being investigated for a range of immunoinflammatory diseases, including ulcerative colitis, Crohn's disease, atopic dermatitis, that same word I can't pronounce, and alopecia. So Pfizer had already told people a week or so ago that their drug, which treats alopecia, had had a successful phase 3 trial, and they re-released the information a couple days after everybody's talking about alopecia. Why would they do that? Is it just because they just want to make sure, they just want to make sure that you saw this from a week ago and maybe you didn't? Or is it because, well, there's an opportunity to capitalize on a news event from which you could make gazillions of dollars? We have the New York Times. What is alopecia? Jada Pinkett Smith's hair loss condition played a major role in an incident at the Oscars. Here's what we know about it. CNN, what you should know about alopecia, the hair loss condition affecting Jada Pinkett Smith. People, Jada Pinkett Smith has been open about her alopecia. Here's what she said about hair loss. And then USA Today, what causes alopecia? Here's what Jada Pinkett Smith has said about the condition. The reason I'm even talking about this is because I used to work in corporate news, and I know how this press release train telephone game works. And I figured I could at least just add a little bit of context to this so that this happens in the future, something big hits the headlines, then all of a sudden we're talking about a particular angle of it. We might all sit back and say, is there somebody who could benefit from this particular angle? I don't know, and take a look at it. And you know what? Like I said, you may not go down the whole wagon trail like Hugo Talks did, saying that the whole thing was staged for that purpose, but to just pay attention to particular events that may happen organically. And there's all kinds of special interests, like crocodiles around the canoe, waiting to use it for their benefit. And so you see a press release come out right after that. Listen, when I was in corporate news, we would sit around editorial board. Oh, hi. Hang on, I have to get my producer some milk. I'll be right back. Okay, I'm back. Anyway, what I was saying was when we would have these morning editorial meetings, for instance, and something like what happened at the Oscars had just occurred, we're looking for every possible angle because we know everybody's talking about it. We want to know, what does the body language say? And what about the history between Will and Jada, or Will and Chris Rock? Or what about this disease? We should talk about this disease. And then somebody who works for maybe a Pfizer-funded think tank, scientific think tank, or maybe a hospital group, sends out a press release that says, hey, our experts are willing to talk and available all day long. Just call this number and we'll talk about alopecia. And then you tee it up for the causes and then, the potential treatments that are all basically aligned with this particular medical worldview. And that's how it happens. It happens because you have corporate news stations that are just trying to churn out this material and they want to keep you watching. And if they think that you're going to watch this, they're going to just hit every possible angle that they can. And then there's the marriage of the special interest that's like, we know that they want to keep this going. We know they're in their editorial meetings trying to figure out how to keep this going. Let's let them know we have the experts that are willing to come on and talk about it. And there may be all kinds of other factors that may go into a disease progression and a treatment that may have, completely different perspectives than what you're going to get from these experts because, say the non-pharmaceutical side of it that might tell you, hey, get more vitamin D, take cod liver oil or something like that. Those people are not using multi-gazillion dollar press agencies, or they don't have big corporate press teams or whatever, and so they're not emailing. So you're getting the emails from the hospital group or the drug company that has plenty of money and time to work on getting their perspective on, and then that's how it is, and then it's teed up and ready, and then boom, now there's a drug for this thing that now everybody knows about, and then they also are primed with like, well, this is the condition, this is why it is. And, I sit back and think about how many press releases were coming through every day. Dozens would be minimal. That would be like the low end of the scale would be dozens of press releases would be coming in every day on any number of topics. And honestly, I'm somebody who I've talked very publicly about one time when the Department of Health sent out a press release saying that a doctor in our area, if Seattle, was experimenting on his patients, which was really not the truth. And at least, even if you sort of agreed with what the Department of Health was trying to get across with suspending this guy's license, that was definitely not the full truth. We should have gotten more information from that doctor before we ever ran with the story. I was a reporter that was on it, and we needed something at 11. My boss was just do this. And here I was, somebody who just repeated what the Department of Health said. Then a couple days later, I finally talked to the doctor, sit down and interview him, and find out there's a whole nother side of the story. All these patients who then had their treatments thrown out and would never have called it experimenting. And that whole thing should have run together. But why did we just trust the Department of Health, who sent us a press release, and we just ran with it as if they were there to help? But this is happening constantly, not just from the government, but from corporate interests that, like I said, hey, we have these medical experts. And of course, if it was as obvious as Pfizer emailed us about their new drug, we should push their new drug, that would not happen. At least I can't say it wouldn't happen, but that's not how it usually happens. No reporter goes into a morning editorial board meeting and says, 75% of our funding comes from pharmaceuticals, so we better make sure to push something about pharmaceuticals today. That's not how it works. They think they're doing some kind of public good, right? So the way that the manipulation happens is like, oh, hey, Allison, this is blah, blah, blah from this hospital group, or like, the pro-science think tank of Seattle. And, we have doctors that are specialists in this particular disease, and they all happen to have the same funding and interests, and they run in the same circles, and they went to the same colleges and medical schools or whatever else. And that's how it happens. Like I said, it wouldn't work if Pfizer just called you up and said, oh, guess what? Since you guys are all talking about alopecia, we're trying to make like $1 billion off this new drug. So if you could do a couple stories about it and push our drug, that would be awesome. The vast majority of people are not going to be like, reporters are going to, oh yeah, then they would go, no, that's propaganda. And they would be able to pick up on it then. But they don't, and like I said, for me, I look back on the many times that I repeated a press release. Why wasn't I more skeptical? Why weren't my bosses encouraging more skepticism? Why do we just trust the authority? Right? When a lot of times these authorities have their own special interests, it's not about public health or public safety. So anyway, this is not to say that I know for sure that Pfizer was sending out press releases to these agencies or newsrooms, or to say that Pfizer was calling up its funded think tanks and then saying, call the newsrooms and tell them to talk about this and the experts. I don't know that for sure. I don't know if this was a staged event or a real event for sure. This is just to say that as somebody who witnessed how a current event is used to push an agenda, where it doesn't have to always be full conspiracy where it was completely staged for that, but a special interest sees an opportunity to swoop in and then frame the narrative to benefit them. I've seen that happen over and over again. So I just figured I would share that, anytime you see a lot of press agencies talking about something and talking about it in a very similar way, it's very possible that that narrative is being framed for them, and they are just the stenographers for it. Anyway, thanks for watching this video. Don't forget, if you want to support my sponsors, I have a new one that will help you see more clearly, not necessarily what is conspiracy, fake, real, but to see more clearly the world around you. And those are my betterspectacles.com, betterspectacles.com/Allison. These are the blue light glasses that I wear to edit, but they also specialize in very difficult prescriptions. In fact, their progressive lenses are some of the best in the world. These are Rodenstock glasses from a 144-year-old German company that are now available in the US, betterspectacles.com/Allison. They have really helped my husband, who's a disabled veteran, with his eyesight issues.
The reason why I have to wear glasses is because of some of the explosions that I've experienced. It causes my left eye to constantly do this. So when that happens, my right eye tries to syncopate, and it creates basically migraines that I can't do anything.
And don't forget that if you want to see more clearly while sipping a nice Malbec, you can check out AllisonWinePromo.com. That's Allison with 1L winepromo.com, and get 50% off of my favorite Malbecs from Argentina. One from a very high altitude vineyard, almost 9,000 feet. Another one from the oldest vineyard in Argentina, and another one that uses natural fermentation. They're all unique wines and all very good. So go check out my sponsors, betterspectacles.com/Allison, AllisonWinePromo.com. And of course, if you want a good cup of coffee, check out TwinEngineCoffee.com/Allison, and I'll see you next time.